Hello, my name is Brittany. I am a registered nurse. I am here today with my patient,
Matthew.
and today we're going to be testing our Matthew's cranial nerves. There are 12 cranial nerves that we'll be going through. The first nerve is your olfactory nerve, which is cranial number 1. Unfortunately, we'll not be testing for that today at this time. We'll be moving along to cranial number 2, which is your optic nerve. We'll be testing for visual acuity and peripheral vision. So Matthew, if you can you please stand for me? We're gonna start testing for peripheral vision first. Matthew, I'm gonna have you cover your right eye, and I'm gonna cover my left. Your left eye, I want you to look directly at my uncovered eye, and I'm gonna be holding numbers up, and if you could please read back those numbers, okay?
1, 2.
Okay, can you cover up your left eye?
2, 1.
Okay, good. Next, we're gonna be testing for visual acuity. I'm gonna have Matthew be about 20 feet away. What he's gonna do is he'll be covering each eye, and then not having both eyes covered, and he'll be reading the lowest line that he can read. Do you wear any corrective lenses or glasses?
No.
Okay, so Matthew does not wear any glasses or any contacts, so we are good to proceed. And can you please read for me the lowest line that you can?
D-E-F-P-O-T-E-C.
Okay, and I'll have you cover your left eye.
D-E-F-P-O-T-E-C.
Good. And then both eyes.
D-E-F-P-O-T-E-C.
Good. So Matthew is able to read line 8, which is 20/20 vision. We are going to say that his cranial nerve 2, which is the optic nerve, is intact. He was successfully able to read back the numbers for his peripheral, and then he did good also on the visual acuity. Matthew, you can have a seat. Next, we're going to be testing for cranial number 3, which is the oculomotor nerve. We're going to be testing for extraocular muscles, and so we're just going to make sure that they are intact. So Matthew, if you look at me, I'm going to have you follow my finger, keeping your head stable, so that means not shifting or moving it, okay? And just follow my finger. Okay. EOMs are intact, no nystagmus. And next we're going to get out our pen light. Matthew, you're going to look straight at me, and then I'm going to have you just look at me straight, and I'm going to look at your eyes, okay? And see if your pupils will constrict. Okay, pupils, they were symmetric, they were brisk and constricted as well, and we're going to now do one at a time. Pupils are about a 3 on each side. Okay. Pupils are bilaterally equal and reactive, round and reactive to light. Next, we are going to move on to cranial number 4. Matthew, I'm going to have you follow my finger, okay? Okay, so this test is for accommodation, and now that we can say that Matthew exhibits perla, pupils are equal, round, and reactive to life, and are accommodated. This is cranial number 4, which is your trochlear nerve. Next, we're going to move on to cranial number 5, which is the trigeminal nerve. I'm going to have Matthew just open up your that is temporal. Open up your mouth for me. Okay, and close. So that is symmetric. And next, I'm going to hold my hand under your chin, and I want you to try to resist my hand, okay? With your mouth. Okay. And there was resistance as well. We would say that cranial number 5, the trigeminal, is intact. In this, we also test for sensory with the scalp, facial, cornea, and mucous membranes, but we're not going to be doing that at this time. Next, we're going to be testing for cranial number 6, which is the abducens. And this is testing for lateral movement of the eyes, which we already did with cranial and cranial number 3 with the extraocular muscle. So we will say that cranial nerve 6 is intact. Next, we will be testing cranial number 7, which is our facial nerves. Matthew, I'm going to have you say your name, Matthew, for me, okay?
Matthew.
Labial speech is exerted here. And I'm not gonna pretend that you are like you're chewing or eating like a piece of candy. Okay? And then I'm going to have you smile for me. Try to make a frown. And then I'm gonna have you puff your cheeks out for me. Okay. We would also in this portion test for tears and taste and salivation by eating like for instance like a sweet or a sour candy of some sort. But we're not going to be doing that portion now. We would say that cranial number 7 is intact. Next, we're going to be testing for cranial number 8, which is the acoustic portion, and also equilibrium. Unfortunately, we will not be testing for equilibrium. We will be doing that later on in our head to toe assessment. So Matthew, what I'm going to do is I'm going to cover your ear, and then I'm going to whisper, and I need you to tell me what I said, okay? So first we'll start with your left ear.
Dog, cat.
Yes, we'll be doing your right ear.
Cat, dog.
Okay. Matthew was able to recite to me back what I whispered. We would say that his acoustic or cranial nerve number 8 is intact. Next, we will be moving on to cranial number 9. This is the glossopharyngeal nerve. So, unfortunately, today I do not have a tongue depressor, but I do have a clean plastic spoon that we're going to be using. Matthew, do you give me consent to use the spoon?
Yes.
Okay. So first I'm going to have you say ah, and we're going to check if his uvula is midline, and then if it rises as well, as he's like saying ah. Open. I need you to open like wide. Open wider. Okay. Uvula is midline, and it rises as he is speaking, saying ah. Next, we're going to test for his gag reflex. We'll say ah. is intact. So we would say cranial number 9 is intact. Next, we will be moving on to cranial number 10, which is the vagus. So vagus nerve. So Matthew, I'm going to have you state your name and date of birth.
Matthew Mitchell, 12/14/1991.
Okay. As you can see, Matthew's speech is clear. There's no hoarseness in his voice. And then also, Matthew, are you able to swallow for me? Was that clean and clear?
Yes.
He was able to swallow too without any abnormalities. Next, we'll be testing for a cranial number 11, which is like your spinal accessories. I'm going to ask Matthew to basically move his head from side to side and up and down with resistance. So I'm placing my hand here. If you could try to turn your head to your right. Okay. Placing my hand on your left. If you could try to turn your head to your left. I'm placing your head up here. If you could try to go up. Okay. And then I'm placing my hand under your chin. If you can try to come down with your head. Okay. And then next, try to do a shrug with your shoulders. Okay. And there was resistance in all areas that I assessed. We would say that cranial number 11 is intact. And last but not least, cranial number 12 would be our hypoglossal. We were going to basically check for Matthew's tongue and make sure that it is midline. So Matthew, if you could just stick out your tongue for me. Stick it out. Okay, can you move it from side to side for me? Okay, his tongue was midline and he was able to move it from side to side. So we would say that his cranial number 12 is intact. Thank you for watching with us today. Thank you, Matthew, for your time. This concludes our cranial nerve assessment.